So first and foremost, I just wanted to share my appreciation for being here and presenting on this topic of supporting families of loved ones who are in treatment, specifically in SED treatment or substance use disorder treatment, because this is a topic that's very near and dear to my heart. My name is Michelle Paquin-Lozano. I am a certified substance abuse counselor as well as prevention specialist. I'm also an adolescent provider with Hina Malka's Teen Care program, where I was actually introduced to this presentation group through my director, Dr. Colleen Fox. So, why families? Why is this a topic that I find so important? Well, professionally, as I said, I do work with adolescents in treatment, and the topic of family comes up very often, especially since most of them are still living at home and tend to be a source of stress for a lot of folks. However, I've had the opportunity of not just working with the youth themselves and making positive change, but I've also been able to see the potential of what that partnership can look like when family are involved to sustain that long-term recovery, long after they leave our care. So, in addition to my professional experience, I'm also coming into this space with lived experience as a person in recovery myself. Obviously, I've seen the destructive nature that this disorder had on my family, but most importantly, the critical role family support and involvement have played in sustaining my own long-term recovery. Right. So before we begin, I just wanted to make a quick note that this presentation may include content that can be emotionally challenging or distressing for some of us. I found that whenever topics of family or SUD are discussed, it can bring up some strong emotional feelings for us, especially for those who are in recovery themselves, or maybe they've been touched by loving a person with an addiction. So as always, please do take care of yourself in whatever way you need throughout this presentation. I know some of you guys are on your lunch break, so continue to nourish yourself. If you need to keep your cameras off or walk away, that's totally fine as well. So I do have a few intentions that I hope that you guys are going to walk away at the end of this presentation. The first one is I hope that you guys will be able to identify the impact of substance use disorders or SUDs on family systems, and then also the critical role families play in recovery. You'll be able to describe common challenges that families face when a loved one is in treatment and post-treatment, and then hopefully as providers apply practical strategies to engage and support the families of our clients that we're working with. So we already had this little icebreaker question, but feel free to continue to drop in the chat, what feelings or words come to mind when you hear family? And like I said, I'm really happy to hear all the positive feelings and thoughts that came through the chat, because to be honest, when I thought about family, or especially working with families at first, it's very anxiety provoking, especially since, you're not just working with that individual in front of you, but you're also managing the emotions and personality of a group of people who has this shared history with one another, which can be very challenging at times. So I wanted to go ahead and start this off by kind of thinking about how we define or how we describe what a family is. So there is no one definition of family. I think that is safe to say. Families look different to all of us. In a traditional sense, families can be determined by birth, marriage, or adoption. However, in others, this definition of family is so much more expansive to also include individuals who you sometimes share a household with. Doesn't have to be. You have shared values, emotional connections, and then commitment to one another. I like these two definitions in particular because I feel like there is this common theme that family are pretty much those who you have a shared responsibility to care for one another. So just as there are many definitions, there are definitely different family types of families that often goes beyond the nuclear family, which, as you know, is typically parents and their biological children. Families can be blended, which include children from previous relationships, or they can be intergenerational with extended family members living under one household. Of course, there's mixed families, which can include family members who are not related biologically or through adoption, such as foster families, or maybe those who come together by choice. So if there's one thing I hope everyone today walks away with is this realization that you do not need to be a licensed therapist to actually do meaningful family work. So according to the SAMHSA Tip 39, there is a difference between family-based interventions, or sometimes called family counseling, and family therapy. So in family counseling, this is typically the type of intervention that you're going to see in a substance use treatment setting, which will involve psychoeducation about addiction, how this affects the person with the SUD, or also how it affects the family members, what recovery can look like, and then just how to develop, some of those skills that are needed to sustain that recovery. There's also assistance to family members, such as referral to additional services, maybe getting them connected to community resources. Treatment in the SUD setting is going to involve families at different points along the continuum of care and engage in interventions that at varying intensities depending on what their needs are. So this type of intervention is still going to identify the client as the person with the substance use disorder and then brings the family into the process. So family therapy, on the other hand, this is when we're treating the entire family as the primary client and we're intervening specifically on a systems level. So to identify as a marriage and family therapist, there are specialized training and licensing requirements. But like I said earlier, you do not need to be a licensed therapist to do meaningful family work. So why do we talk about family counseling and treatment? Most, if not all of us, especially those who are working in this setting, have recognized that families affect and are affected by the substance use disorder. So an SUD is a lifelong, often complex condition, and it inevitably affects everybody involved in that person's life. So those with an SUD are influenced by their environment, while at the same time influencing those around them. This is especially true for those who are closest to them, which includes significant others, spouses, children. In our case, working with adolescents, we do see the effects on the parents, grandparents, guardians, and then sometimes siblings, which tends to get forgotten in the mix. Another reason we integrate family counseling into treatment is because a family is a complex system and their whole purpose is to keep equilibrium. So I'm sure most of you have heard of the term homeostasis, which typically means stability or balance. And this concept suggests that families are going to respond to any instability and disharmony by reacting, whether that's emotionally, cognitively, or behaviorally. And the whole purpose of these reactions is to maintain balance in the interest of preservation or maintaining the status quo. So when substance misuse occurs in the family, this instability or disharmony is going to create or cause members to try to manage these behaviors of the person who's misusing, or maybe managing some of the symptoms or consequences of use, such as school suspension, multiple DUIs, job loss, domestic violence, and so forth. So families are often going to go through a range of responses that may be viewed as unhealthy or enabling, which we will talk a little bit about later. And they tend to be seen as counterproductive to those outside the family unit. However, as providers, it's important for us to recognize that these responses are normal and they ultimately serve this purpose of keeping the family system operating. So family counseling honors the role families play in the change process of our clients. So these interventions acknowledge that families are a system, and they recognize that when change occurs in one part or one family member, all others are going to be affected in response. So while individual counseling can do great things in helping the clients learn new skills and develop insight, and that is typically going to help them make behavioral changes, these counseling sessions alone does very little to prepare them to sustain these changes, especially as they start going back into their environment. Sorry. Okay. In fact, without the proper guidance to the family members, the families and significant others, they won't know or be ready to respond to some of these change behaviors. And sometimes they start reacting in a way that dismantles the progress the clients have made already so far. So some examples could be being overly suspicious of change behaviors, not giving them a chance to show them that they have been making changes. Sometimes we hear about parents treating them the same despite the efforts that the client has made to make those changes. And I think it's important for us to recognize that these responses are very normal because more often than not, the families have been experiencing the symptoms of their loved one's substance use long before their loved one has started seeking treatment. So family involvement does not take away from the individual, but it does recognize them as a ultimate resource to maintain long-term recovery. I apologize in advance. I am in a school, so you might be hearing the bell ring a few times. So finally, families greatly influence treatment outcomes. Integrating family counseling into treatment underscores the important role families play in helping their loved ones change their substance use. So when we start to widen that focus from the individual client to them and their families, we can start creating this transparent atmosphere, allowing for more insight and development of new skills. So additionally, clients will have this opportunity to see that their families are not blaming them, but they're just trying to get them the help that they need. So some benefits of family involvement in treatment includes motivating individuals to receive or continue treatment. Involvement is also linked with increased rate of entry, reduction of STD treatment barriers, decreased dropout rates, and then better long-term outcomes. We also see an improved overall family functioning between the client and his or her family, especially since they are starting to become more part of this process and they're more aware of what recovery can look like. Family involvement fosters healing for all those that are affected by addiction. We can create this neutral space where families can start addressing problems and identify needs. So by mediating some of these sessions, we create this space where sharing is possible. Other members can gain a broader perspective and they start to gain a better understanding of one another. And then ultimately this provides them to the opportunity to build insight, compassion, either it's towards the client themselves or then maybe the other family members that are affected. And then finally, treatment can also reduce risk of other children and adolescents being exposed to violence or developing STDs later down the line. So I did share some things to consider why family involvement is so critical for our clients' recovery. But what about the families themselves? How does this benefit them? Well, that's because families are hurting too. And as I heard said once, and I feel like this is going to stick with me forever, is that hurt people hurt people. And whether it's intentionally or not, it's really difficult for families to give their all and care for their loved ones when they themselves are in need of healing. So when substance problems enters the picture, family members often are going to experience a range of emotional pain, and there is a disruption of family life. So while the attention is usually placed on the individual with the SUD, the overall family pain and distress tends to get ignored, such as parental stress of missing work, because some things that we've heard is having to miss work so they can respond to any crisis, picking their child up from school when they get suspended, picking their child up from the police department in some cases, or unfortunately sending them to the hospital. In addition to the parental stress and stress of other family members, we can sometimes see the case of when other siblings in the household, they start to feel forgotten or neglected because so much of that attention and energy has been placed on that person with the SUD. So some examples of how SUDs affect families are listed here. So, for example, preoccupation with the member with the SED. So, again, I do work with adolescents, so a lot of times those are the kinds of examples that come up. But of course, these symptoms can also be true regardless of who has the disorder. But we do find a lot of preoccupation with that member, whether that is again attending to all of those crises, trying to put out the fires. But then there's also trying to manage the symptoms of substance use disorder, which can be very emotionally taxing. We see some overfunctioning happening, especially if like maybe if the parent is using, the older siblings might have to step up and kind of take care of some household chores or taking care of their siblings. There's also mental and physical health decline of family members because again they're so preoccupied with taking care of their loved one that they start to neglect their own needs. Unfortunately, we do see abuse, neglect, and violence when substance use disorder are not treated, loss of life, relationship problems, not just within the family, but also isolation of other family members or friends or support networks, especially as the family is trying to navigate this alone. Role reversal, and then financial problems. So compared to those without SEDs, couples have worse relationship functioning, greater risk for IPV and separation. Having a parent with an SED also poses greater risk for the adolescent to engage in substance use themselves. And there's also risk for lower family quality and parental monitoring, which tends to be predictive of adolescents turning to substances and more risky behaviors. So, what can we do? It's important for treatment providers or those who are working with families where substance use is involved to offer empathy and understand when working with the entire family. First and foremost, it's always important to acknowledge our underlying biases and beliefs about the families we work with and recognize that we all do have biases, whether it comes from our own lived experiences or maybe what we see in practice over time. So, as we know, substance misuse can come out of family dysfunction. So, as a result, this can be very tempting to blame or point fingers when we start working with everybody else in the family. It's easy for us to be on the outside and feeling frustrated and just asking if only they would just change their ways. So, not only can being able to recognize common challenges help us understand what the families are experiencing, but this can also foster non judgment when we work with them. So, by improving our understanding of these common factors, we can avoid judgment or pathologizing family members and instead greet them with empathy and understanding of the challenges they're facing as a result of loving somebody with an addiction. So, empathy can help a provider's readiness to hear what families need while strengthening the relationship with family members so that they can all move towards this recovery together. Another thing we can do is to kind of reframe that narrative from labeling family behaviors as enabling to one that is more understanding of them as being protective responses, which are oftentimes rooted in love, fear, and the hope of helping. So most families can agree that watching a loved one struggle with SUD is very difficult, and not knowing how to help them is painful. Sorry. So as a result, a common behavior that arises when SUD threatens the family functioning are sometimes what we call enabling behaviors. So these behaviors, they tend to take on additional responsibilities, which shield a loved one from legal or social consequences. And typically they do come from a place of love. So even if these behaviors encourage continued substance use while discouraging any reason to seek recovery. So give me 1 second, my throat's been a little dry lately. So an example that I have here is sometimes when we see like an adult child who's misusing prescription opioids, they might continue, the parents might continue to give them money, let them live at home or bail them out of jail. And again, it's because they're just trying to protect their child. So by shielding their son from the negative consequences of use, their son actually doesn't develop that needed motivation he needs to change these behaviors. So while these behaviors from the outsider perspective can seem very counterproductive or be quote unquote dysfunctional, it is a family's way of protecting their loved ones from harm. So most families who engage in these behaviors do not realize that what they're doing is maintaining their substance use. And it's important to remember that families are doing the best they can with what they have and what they know. Um, it's also important for us to recognize that these responses are common and they're normal reactions among the family members. So, as providers, it is important to offer gentle education about why these behaviors work against recovery, and then work with the families to develop more adaptive ways to support the individual without supporting the substance use. So there are several evidence-based family interventions out there. Unfortunately, we do not have time to list them all, but instead I wanted to compile a list of some similar core principles when working with family systems. So this is not an exhaustive list. However, these are some things that I was able to pick out. So the first one is recognizing the therapeutic value of working with family members and not just that individual with the SUD. We also want to acknowledge the value of relationship within the family and social networks for support and encouraging positive reinforcement. It's important to incorporate a non-blaming collaborative approach. It's also important to be aware of the power dynamics between us as the provider and the family. So counselors can work towards reducing or eliminating this power structure by understanding his or her place as the outsider to the family system, while still engaging with genuine curiosity and interest and working alongside the family to aid in this healing process. It's also important to have harm reduction goals other than abstinence. Sometimes when we're working with families, the goal may not be abstinence due to various reasons. So it's important to recognize this and offer harm reduction strategies so that we can still bring about positive health benefits to the individual and the entire family. We also want to expand outcome measures of what successful treatment looks like to include health and well-being of the entire family, as well as the person with the SUD. It's important to work with family members to identify their own terms of what treatment success looks like. We also want to appreciate the importance of adapting family counseling methods and fit family values and cultural beliefs and practices, whether that is adjusting our own practices or also recognizing when referral may be necessary. Understanding the complexity of SUDs and the importance of working with families so that they can manage these symptoms that have been affecting family functioning for a while now. So oftentimes, those who are seeking treatment may not be ready to include their families. And this is to be expected, especially when a lot of them might have a long history of family dysfunction or heartache. Sometimes it could also be the case where the families who bring their loved ones to treatment are on their last legs. They are feeling worn out, they've had enough, they've given it their all, and by the time that their loved one seeks recovery, they feel that their involvement in treatment is done. Either way, it's important for treatment providers to acknowledge and prepare for these scenarios and encourage both the person with the SUD and their families to engage in this process nonetheless. So while families can be a source of support, it is important that their recovery needs are also being met in this process. So these are just some 10 action steps a provider can take to try to engage families in this process. I think the first one is introducing family involvement as early as possible. We can do this by discussing the benefit of family involvement in treatment with the client as well as the concerned significant others, especially during like the initial meetings. And even if the client themselves are not ready to involve them, it's still highly encouraged to continue that conversation and revisiting it as you see necessary or as you see it fit. Because a lot of times, I do find that they kind of start to give into that idea of what it might look like if their family knew a little bit more, maybe if their family was part of this process. It's important that we ensure safety and cultural appropriateness along the way. So we want to assess safety and cultural relevance of involving families, adapting your approach to each of your client's unique situation. Obviously, obtaining the proper consents, identify and map support networks with your client, having them tell you who their key supportive individuals are so that they can start being engaged in this process. We want to involve family members in the initial sessions and then also collaboratively determine what topics will be discussed to maintain structure and focus throughout. So what we do at Team Care right before we have a family session, we try to sit with the client themselves and ask them, okay, what is on the table and what is off the table when we have this session with family. And then, of course, when we have the session, kind of just having this clear agenda of what this session is going to look like. Just so that we can kind of stay on topic because it can go in many different directions otherwise. You want to provide families with accessible, relevant materials about addiction, recovery, and their role in this process. Support families in developing healthier ways to communicate, especially around high conflict or emotionally charged issues. So again, during these sessions, there's a lot of mediating, really getting comfortable with interrupting and just saying like, all right, you spoke, we're going to go ahead and move on a little bit. Creating space for clients and families to share their own recovery experiences, because this really does help build that mutual understanding and hope for recovery together. We also want to include family and significant others in the continuing care and relapse prevention planning so that they can start creating their own long-term accountability. And then finally, we always want to encourage families to prioritize their own well-being. Get them connected with mutual help groups and community support services in their area. Because again, it is really important that they do start taking care of themselves and meeting their own needs that a lot of times they have neglected for a while. And this actually brings me to my very last slide, which are some family support groups that are both here on island, but as well online or virtually for those who are not here on Oahu. So the first two are Hinamaka programs. The first one is the Hinamaka Family Program, which is an educational support group. And they are open to family and friends of individuals who are struggling with alcohol or other drug use. Groups are in person on Saturdays in Kaneohe from 10 to 11:30. And these groups provide psychoeducation on addiction. There's guided discussions on how addiction impacts families and relationships. There's opportunity for skill building tools for effective communication, as well as a sense of community and belonging. So there is a participation form that's needed to be filled out and submitted before participation can begin. The other group we have here on island is the Teen Care ITC group, or the Invitation to Change group. And right now, these groups are open to families of clients who are currently in treatment at Teen Care. So groups are based on the CMC Invitation to Change approach, which emphasizes compassion, connection, and the vital role families play in recovery. So we have guided discussions. We also have practical tools that families can walk away with. The group itself is divided into 3 segments where we really teach parents or guardians on how to help their loved ones with understanding, that behaviors do make sense. It's just a matter of having that conversation with their child. Helping them also with awareness of how have they been affected by their child or their loved one's use, and what are they doing to take care of themselves and fill their own cups. And then, of course, helping with action, which involves communication or behavioral tools. So this is a bit of a newer group. They are virtual, but in my experience, they have been very helpful for the families to find this sense of community, especially because dealing with substance use, especially a loved one who's using, it can feel very lonely. And, it's very difficult not knowing how to navigate this, especially as a parent. So in addition to those two groups, we do have the CMC Foundation for Change, which is where we got the Invitation to Change group from. And this is where you can actually find a directory of other groups available with this model. There are in-person, online, and hybrid options. If you are interested, I believe I sent out a PDF form with all of these links for you to have a look at to see if this is something that you feel like your family may benefit from. And then finally, we do have the Al-Anon Family Groups of Hawaii, which is a space to provide support and guidance to relatives and friends. It does say it's for people with alcohol use disorder, but from my experience, the pain, the hurt, the consequences um, don't differ very much, regardless of what substance is being used. So there is a directory on their website as well of what ongoing virtual groups are available here in Hawaii. All right, and I think that so that actually brings me to my last slide. So that is all. Again, thank you so much for allowing me to talk about this. This is a topic that I feel like is very much needed, especially in the treatment arena.